When Zora first came in for her dental cleaning, everything was fine. She had been in for a wellness visit just a few weeks before. Everything checked out completely normal. So when I did her pre-surgical exam, I was a little bit surprised to find that something felt not quite right inside her abdomen. Her stomach was full, but it didn't feel like food. It felt different in a way that I couldn't even really explain. So I immediately called her owner and asked whether or not we could get an x-ray. She said, of course, whatever you think Zora needs, go ahead and do it. And the x-ray actually ended up giving us more questions than answers at that time. There was definitely something in there that contained some mineral, but it didn't have a really defined look to it. Zora is one of only a few cats that I've seen that are fed a home-cooked diet. And I knew that as part of the diet that Sarah cooked chicken thighs that had the bones still in them and ran them through a meat grinder. So I wasn't sure if the calcium from the bones in the diet might be causing some of the appearance on the x-rays. So I called Sarah back, we talked about what I found, and she assured me that Zora had not been having any symptoms of illness. She hadn't been throwing up. She was eating normally and drinking normally. So at that point, we just decided to proceed with her dental cleaning and went ahead and sent her home with a plan to follow up and look at the x-rays again in a couple of weeks. About a week later, I got a call back from Sarah, and she told me that Zora was doing okay, but that she was not quite normal. She wasn't eating with the same vigor. Her attitude just seemed a little bit off. So we decided to go ahead and bring her back a little bit sooner than planned. And we took another x-ray to see whether or not those streaks of mineral were gone from her stomach or if they were still there. And sure enough, they were still there. And they were a little bit more well-defined the second time. And I could actually make out some areas where they almost seemed to have kind of a circular appearance in the center of the stomach. And that's the point at which my brain, I had that aha moment, and I knew that this cat has eaten something. So I went back into the exam room and I said, Sarah, by any chance, do you use hair ties in your hair? And she said, well, I do, but I haven't been able to find any recently. I wondered where they had gone. And at that point, you know, we knew. Basically, she had occasionally seen Zora chewing on them. She was not aware that Zora had been swallowing them. And fortunately, since this wasn't an emergency situation, we didn't have to rush into surgery immediately. We were able to take a little bit of time to plan it. So a few days later, we brought her back in, put her under anesthesia, and we ended up taking, I believe, 8 hair ties out of her stomach that day. It was a very exciting and eventful day. Since then, Zora has not, to my knowledge, eaten anything that is not food since then.